Hello, my name is Julie Verdier. Today I will be presenting the operating room setup, the patient positioning, and the draping for shoulder arthroplasty. The operative room setup has many goals. We must work safely by keeping in mind that the patient is the priority. The quality of care is important for both patient and surgical team. We must take care in guiding the sterile environment of the OR by checking the proper function of the equipment and also limiting the number of visitors in the OR. In the morning, when we arrive, we have to carry out the checklist of the OR. The most important thing is to make sure that the air pressure in the room is positive, so that the surgery can be performed in good sterile conditions. It is also necessary to make sure the electricity and the emergency circuit function in a proper fashion and anticipate any possible dysfunction. The cleaning of the surfaces and equipment of the operating room must be done beforehand. Next, we check equipment. The operating table and the section must be functional. The specific equipment such as electrocautery, tables for instrumentation and implants must be present in the OR to avoid excessive door movements. Finally, in case of visiting surgeons, we must ensure the proper function of the video cameras in order to follow the intervention. Here you can see the checklist that we must complete and check every morning at Pasteur 2 during our opening of the room. Just to show examples of the different equipment that we have in our operating room, here you have the emergency circuit, the electrocautery, the suction, and the light with the video camera. Here you have the operating table with the different support and anti-decubitus cushions used to install patients for shoulder surgery. This is the cart for the implants, and these are the equipment table. For the arthroplasty, we use B-chair position. The arm is free to move and the shoulder blade is free from the table, which allows us dynamic control of the arm during surgery. Here is a video example of a patient sterile prep and draping for shoulder arthroplasty. Once the patient is under general anesthesia, the assistant nurse, the resident, and the surgeon install the patient. The support and the anti-decubitus cushions are positioned for the comfort of the patient. The sterile skin prep is done with a combination of betadine and alcohol and includes the hand and forearm. Then we start draping, and gloves are changed after the first layer. We need 2 tables for the instrumentation. One of the 2 tables is positioned over the patient and one behind the nurse. You can see the nurse face the surgeon. Following draping, the skin is marked for the surgery and new bond is applied. Finally, the forearm is draped in a sterile wrap. After the draping, you can see the final setup for a shoulder arthroplasty. The lights are positioned with the video camera who face the nurse. What are the important points to remember? The checklist is very important and guarantees good management of the patient as well as sterile control of the OR. Good patient positioning ensures better quality and comfort for the surgeon and the surgery. Thank you for your attention.